Welcome to the Journal of Acute Care for Occupational Therapy, a twice-yearly published research journal that is focused on the role of occupational therapy in an acute care practice setting. This tutorial will present an overview of the journal's manuscript submission process for authors. As mentioned in the previous slide, the focus for the Journal of Acute Care Occupational Therapy is to provide a platform for the dissemination of evidence related to occupational therapy in acute care contexts. It is the goal of the journal to promote the role, scope, and value that occupational therapy can bring to acute care by providing evidence to the profession's unique contributions with timely, relevant, and sound evidence that practitioners can relate to and readily utilize. Content areas that the journal focuses on include, but are not limited to, occupational therapy practice, leadership, and education within acute care environments. The 5 types of manuscripts that the journal accepts includes original research, quality improvement or practice guidelines, case studies, educational topics, and scoping reviews. We will explore each of these further in the following slides. An original research manuscript will address practical problems in acute care that are relevant to occupational therapy. The research methodology can be quantitative, qualitative, or mixed methods and should address topics such as effectiveness, experiences, or safety within acute care occupational therapy domains. For submissions that involve original research, we require that sections or header formats include an abstract, introduction and background, methodology, results, discussion, and references. Further details such as word counts, page limits, and reference formats for each manuscript type will be provided later in this presentation. A manuscript that addresses quality improvements or practice guidelines should seek to answer a pertinent clinical problem, address ways to optimize patient care, foster interprofessional relationships and collaborations, or reflect ethical decision-making processes and situations. A practice guideline should be an original or modified script that addresses a specific clinical issue or area within acute care occupational therapy settings. Manuscripts of this type should describe the background of the need. They should include a measurable objective or aim and describe outcome results, and include examples of how the quality improvement or practice guideline improved and affected patient care. Case study or series-based manuscripts should be original and novel in content that adds or improves upon current acute care occupational therapy knowledge and practices. These types of manuscripts need to have a quantitative, qualitative, or mixed methods functional outcome measure that has practical implications on practice or research. These should be detailed around the facts relevant to current theory or research surrounding the case. Case studies should include a timeline of the client processes, experiences, and rehabilitative progress. Scholarly educational manuscripts should address occupational therapy's role as educators within the acute care setting. These manuscripts can involve various instructional mediums such as simulation, role play, and online learning. They may be specific to staff training and assessments and interventions, development and implementation of student curriculum, or focus on client-centered education during an acute care stay. Topics of interest may include curriculum development for students, employee skill building, or implementation of practice models or theories incorporating acute care practices. These manuscripts should also demonstrate background theories or supported frameworks, detail the relevant program or curriculum, describe outcome measures, and address implementations in occupational therapy education. Scoping reviews are a systematic approach to identifying and providing insights into the existing evidence for a particular topic. These types of reviews are comprehensive and review a large body of literature with the purpose of organizing a given topic and offering clarity around the definitions and concepts of the specific topic, whether that be population, an assessment, or an intervention. For authors submitting a scoping review to the journal, do consider topics that are relevant to acute care and occupational therapy. A scoping review should include the scoping review question, demonstrate the author's expertise and timeliness of the review. Authors should include their sources and search processes, such as adherence to PRISMA guidelines, as well as elements such as inclusion and exclusion criteria. Authors should describe their appraisal process and demonstrate a thorough understanding and synthesis of topic of evidence. Here is an overview of the high-level specifications for each manuscript type. Note that some have different page length requirements and others have differing recommendations for the number of references included in the manuscript. In each case, all manuscript abstracts should adhere to 200 words or less. Further, format requirements should include use of Arial 12-point fonts with double spacing throughout the manuscript. All references should use American Psychological Association APA 7th edition format. Here is an overview of the submission process for the Journal of Acute Care Occupational Therapy. The process is considered in 3 stages, including pre-submission, review, and publication, with the review stage involving 4 phases. In the pre-submission stage, authors align their manuscript with the journal's mission, goals, and content strategies and manuscript requirements. Further, authors ensure that they have completed and documented IRB approval within the manuscript, have completed photo release forms, and included all submission agreements. These agreements include the article submission agreement form, the copyright agreement form, and uploading a manuscript without tables, figures, or illustrations. Tables, figures, illustrations, and photos should be uploaded in a separate Microsoft Word document. In addition, signed copyright releases for any copyrighted materials must also be provided. All forms and documents should be submitted via email to journalofacutecareot@gmail.com. The review stage is organized into 4 phases. In the first phase, the journal editors will review the manuscript for eligibility by assessing its alignment with the journal's goals and adherence to submission guidelines. If editors decide to accept the manuscript, it is double-blinded and sent to 2 content expert reviewers who follow an internal review process to score the manuscript. When the reviewers have completed their assessment, the editors receive the reviewer scores and feedback. The editors then decide whether to accept with revision, or reject the manuscript. If the manuscript is accepted with revisions, it repeats the review process, ideally with the same reviewers. In the last phase, the editors have accepted the manuscript for publication. The submission goes through a copy editing process. The 4 phases of the review stage can take approximately 3 months to complete, but is dependent upon the number of revisions to be completed. Lastly, after the manuscript is accepted for publication and authors approve the final copy edits, the manuscript can be published. The Journal of Acute Care Occupational Therapy is published twice yearly in the winter and summer seasons. Also of note, regardless of manuscript type, any submission that involves information or data from human subjects must include Institutional Review Board approval or supportive documentation of an IRB exception. Evidence, including IRB number and date of approval or exemption, should be included in the methods section of the manuscript. It is also highly recommended that authors involved in human subject research complete the Collaborative Institutional Training Initiative, CITI, through their institution or organization. Thank you for watching this overview of the submission process for the Journal of Acute Care Occupational Therapy. For further information, please review the journal website at jacot.org or contact us by email at journalofacutecareot@gmail.com.